October's not just about football, it's also about raising awareness and keeping the community healthy. October is dedicated to raising awareness about breast cancer, promoting early detection, and supporting those who are affected by the disease. Breast cancer is the most common cancer among women worldwide, with 1 in 8 women diagnosed in their lifetime, highlighting the need for ongoing awareness and research. And joining us right now on The Splash to talk about it, we have doctor and clinical professor with expertise in breast cancer, Dr. Monique Swain. Dr. Swain, thank you so much for joining us today.
Well, thank you for having me this morning. Hello.
Hello, glad to have you with us and for a very important topic. I want to get right into it. What advancements in early detection and screening for breast cancer have you seen during your career, and how do they impact outcomes for patients?
Yes. So one of the biggest issues that we faced in screening are women who have dense breasts. And so when I was in training, we had developed a system that could help us to detect cancer better in women who had denser breasts. And so some women may have heard of a 3D mammogram or what we call digital breast tomosynthesis. And this was FDA approved in 2011, but has been growingly popular among women today. And so I do ask my clinician colleagues to make sure that their patients who have dense breasts, um, get a 3D mammogram or a DBT. But even later technologies that has come to the forefront is something called molecular breast imaging or MBI. And this actually kind of is a combo between MRI and mammogram together. So the patients also receive contrast, but also the same technique as a mammogram. And it's really helped to improve detection rates in patients who have dense breasts. So we're really excited about this new technology now, and that we're using this at Henry Ford too as well.
That's amazing. So many great new technology advancements, all dedicated to helping keep people safe. That's always great to hear, Dr. Swain. And with breast cancer awareness having evolved in recent years, particularly in reaching undeserved and or high-risk populations, what have you seen from that angle?
Yeah, so as far as patients, obviously, who have social determinants of health or in underserved areas, there has been a huge push to have what they call mobile mammogram. So these are for individuals who may not have insurance or may not have transportation access to get their mammogram or have a physician to put in a requisition for them. They can now use their neighborhood mobile mammogram to get their mammogram, annually. And I think this is an excellent thing to help kind of bridge that gap in healthcare.
That is excellent and a great way to help promote more screenings and to help again keep that health in line. And I also want to talk about what are maybe some of the challenges you face when it comes to educating patients about the importance of these regular screenings, and how do you address those barriers?
I think some of the biggest challenges are myths that are out there, kind of what family is saying, maybe what their moms or cousins or aunts have said in the past. And I think some of those things are hard things to get through, particularly in my community. Women of color. There's a lot that they have been through experiences in the healthcare system and having that mistrust. And I think getting through those barriers and really getting patients to trust us and know that we're really here for their best interest and we want the best for them. Unfortunately, women of color, we have a 42% higher risk of dying of breast cancer, even though we're diagnosed um, less likely than any of our counterparts. So it's really important for us to instill in them the importance of screening, and that screening is here to help them and not hurt them.
That's absolutely right. For those just joining us on Civic Center TV, we have Dr. Monique Swain, a clinical professor with expertise in breast cancer, sharing some guidance on October being Breast Cancer Awareness Month and ways to keep you happy and healthy. Now, it's not just the physical support that's important when it comes to breast cancer diagnosis. It's also the emotional and the psychological support. That plays a big role as well. And could you talk about a little bit what that does play when it comes to treatment and the recovery process for breast cancer patients?
Yeah, so at Henry Ford, we extremely value psychological support. For any patient that actually is diagnosed with breast cancer, they are referred to what we call psych onc. because we understand the emotional toll that a cancer diagnosis can play on not just the individual, but also on their families too as well. And we realize too that emotional state can also impact the not only just their success rate in terms of treatment, but just their ability to even want to go to treatment. If you're not feeling good about yourself, or overwhelmed by the diagnosis, sometimes we find that patients may avoid coming to treatment, maybe miss appointments. And so we have individuals here who really understand what that is to go through, and specialists here to talk them through that, and guide them through the process. So it makes it easier for them.
That's fantastic. Now, there's a new U.S. rule that's requiring mammography at centers to inform women about their breast density, a regulation that began in early September. In your experience, Dr. Swain, how has this new rule affected patient inquiries or the demand for additional screenings like an ultrasound or an MRI?
Yes, so I am really pleased that this was something that was placed as a rule, and now it gives our patients, the autonomy, and empowers them to ask for the screening that they need, that's necessary for them to identify cancer in their breast. I always tell patients it's really important not only to feel empowered, but to advocate for oneself. And I think knowledge is power. If you didn't know, how do you know what to ask for? And so now that we are mandated to provide this information to patients, their breast density, it gives that patient the empowerment to ask for something that is what's best for them in order to give them the best care possible.
That is absolutely right. Now, it is important to note that it's not just women who can get breast cancer. Men can get breast cancer as well. And I want to ask, how do you approach raising awareness about male breast cancer, and especially within the medical community and the public?
Absolutely, men can get breast cancer as well. Now, the rate is not as high. Their rate is less than 1%. But absolutely, what puts men more at risk is if they have a genetic mutation, specifically BRCA2 or even BRCA1. But BRCA2, more often, it actually can increase their risk to about 7%. So it's really important for individuals that have a family history of breast cancer that not only the women get tested, but the men get tested for a genetic mutation too, because they might be a carrier of a gene like BRCA2 and not realize that. Um, for men, it's really important that they too have what I call breast self awareness. So if they notice something like a new lump, skin changes, nipple changes, or discharge, that they need to see their primary care immediately. Unfortunately, men are much more likely to be diagnosed at later stages because they don't know, because no one talks about it. I just recently gave a presentation last week, uh, at a within the community about male breast cancer as well as female breast cancer. So I think it's important to speak on it, and clinicians like myself to make everyone aware that this does exist and that men are not exempt from getting breast cancer.
That's absolutely right. Even I was a little naive on male breast cancer. I didn't realize that was a thing until maybe just a few years ago. And it's great that information like this is being made public and we're talking about it more, and people are aware of symptoms and can check it out for themselves. Dr. Swain, before I let you go, as someone involved in both clinical practice and academia, how do you see research in breast cancer treatment advancing throughout the next decade?
Yeah, so my main area of expertise in terms of research is actually oncofertility, and so looking at disparities in oncofertility. And I think it's really important that not just men but women too as well. When they get diagnosed with a cancer, not something that they asked for, they're able to have access to fertility, and fertility that, in my opinion, is paid for by our state and by our government, so that these individuals have further rights to go on to have children later. So that's where my area of focus is. But some of the research that's being done today is more looking at biologic markers in cancer and really trying to target therapies to those biologic markers. So what we can do is we can have more individuals who are living now, who are surviving past breast cancer, and really helping to bridge that gap, like I said, and women of color compared to others. So I'm hoping that these advancements come before I retire. And I really would love to see that gap in healthcare disparities close before my career ends.
That's absolutely right. It's very important to close the gap. Dr. Swain, thank you so much for your time today. Doctor and clinical professor with expertise in breast cancer, Dr. Monique Swain. Thank you.
Thank you so much for having me.